particularly in pediatric patients, although, when I say pediatrics, I'm talking about our adolescents and our patients under 12, shot frequency is a big deal. And a barrier to compliance is injections, regardless of how painful or not the injection is. So looking at some of the longer acting agents, and particularly within the class of IL-13s, which we know has a lot of safety behind it, getting to some of these long acting preparations may really be a boon for our pediatric patients, particularly to give them kind of what we've seen in the psoriasis world, where therapies have gone from higher shot frequencies to over time lower shot frequencies, and those become very popular therapies in pediatric patients. The OX40s, I think, is really going to be interesting as well, because the mechanism of action is very different from what we have. So even with all of the good therapeutics that we have right now, whether it's on-label or off-label use, we still are seeing complex patients that don't respond as we would anticipate. And I have been clinical trials investigators for those, and the patients that tend to have failures to other things may be a population that just does need a different mechanism. The other question, too, is going to be around this modification of the T cell population, whether that gives any longer lasting effects, where, again, we have more of maintenance of remission off of therapy, or even any changes in sort of the other kind of atopic comorbidities that develop over time. That's all speculative. Certainly, it's part of the excitement of the atopic dermatitis research right now. But I do think this mechanism of action could bring a lot of new things for us to think about.